Good evening and welcome to the December 14th, 2021 meeting of the Needham Board of Health. I'm Rob Partridge, Chair. This open meeting of the Board of Health is being conducted in person and remotely per the Governor's Executive Order of March 12th, 2020, and as amended on June 15th, 2021 due to the COVID-19 pandemic. The materials for this meeting have been circulated previously and are available on the town website. This meeting is being recorded and public access is available. I will introduce each board member and please respond by saying yes when your name is called. Kathleen Brown?
Yes.
Christina Matthews?
Yes.
Steve Epstein?
Yes.
And Rob Partridge, yes. Okay, so to start off today's fairly busy meeting, we are going to review the minutes. I reviewed them, but I was not at the last meeting.
Take that as an editorial, and we should probably just note on that I joined the meeting.
That one minor change on page 6 of the packet. Second sentence at the top of the test and stay program has not had any positive cases.
Okay, other comments, Kathleen? Okay, a motion to accept the November minutes as amended.
Okay.
Okay, and all in favor?
Aye.
I'll abstain because I wasn't there. So the motion passes. And we will move on to staff reports for November, starting with environmental health. Shara and Diana, I don't know.
I can start off. So it was another busy month. So again, we did hire that new inspector, Sherry, a month ago. So she's working with us now 5 hours a week, starting this month, and then we'll bump up to 10 hours a week starting in January, and then be 10 hours a week from here on out. So we onboarded her this past Monday, and she's a great fit and did some inspections, last week as well. So we were happy with her joining our team. Let's see. So we held 3 virtual food safety 101 trainings with Lisa Berger, one on November 8th, 15th, and November 22nd. Diana proctored those meetings, and they went really well. It's our remote training, so had pretty good turnout. So we were happy with that. We were able to record those and then put them on our website so that we could have that people that couldn't make the training attend and get that training as well. The grant we applied for, so that's pending. We'll probably hear sometime or early next month, hopefully, on that to continue our work with FDA food standards. We have a couple updates on MOUs. Diana, you want to start that?
So we issued 3 different memorandums of understandings with Masala Art, Rice Barn, and Hungry Coyote. So that was just to make it more formal that we have them on administrative watch right now. Going back on the history with those 3 specific restaurants, we've been noticing repeat violations, and they're more on the priority side. So issues with cleanliness and temperatures, items like that are very critical for running a safe establishment. So we drafted up the MOUs to include items, so making sure that they're staying on top of their pest control, that we have permission to speak to the pest control companies so we can work with all parties to make sure that we're effectively treating any problems, whether it's rodents or flies, any type of pest that we may have found in the restaurants, just making sure we're hitting those head on. Each restaurant's also required to keep cleaning logs, temperature logs, and they're supposed to be sending those weekly. I don't know if we want to talk more in depth about Hungry Coyote specifically. So we had a little bit of an issue come up. So we asked the owner to get 2 staff trained, serve safe food protection manager certified. He submitted those 2 certifications. I went in for a re-inspection and asked the staff member who I got a certification for about, it was like just making small talk, how was the test? And he hadn't taken any tests that week. So now we're trying to figure out who proctored it, how did that exam get taken? Because I'm under the impression that they did it online, but even when you do it online, the proctor is supposed to verify the ID of the person and make sure that the person who's taking the exam is actually that person. Because I found it very concerning that I'm talking to someone, and I know it was, thankfully the owner wasn't there to sway the conversation. I spoke to him in Spanish, try to like confirm that what I'm asking was clear, and he confirmed that he didn't take any exams, so I didn't have any outside kind of force coming in prompting him to say, oh, don't you remember we took it online? Like, he didn't know what I was talking about, so a little suspicious.
We had some red flags go up, definitely.
Is the proctor someone in person that's there?
So the proctor, I know online, Tara, you took your exam online, so you can, because during COVID, they were allowing serve safe to be taken online. You're supposed to show, I think, your ID to the camera. They check the room to make sure you don't have extra materials like that you're going to be looking at during the exam, and somebody is supposed to be watching you to make sure you don't pull out the book or anything like that. Because when I go online, I could verify that the certification was legitimate and the proctor is a legitimate proctor, but we're just trying to get down to actually contacting that person to see how that was done, because the person wasn't on the state list either. Not that they have to be on the state list of approved. There's not like an approved vendor list for that. The state has recommended ones that they've vetted, but it's not a requirement. So it's just like a recommendation of people that they know meet the requirements, but technically an establishment can use any trainer that they want to use. So we were encouraging them to use one of the trainers from that list, but we can't make it a requirement because we can't endorse any specific company or anything like that.
Yeah, so we definitely have them on watch, and we're doing like weekly inspections of them just to see if they improve. I'd say Hungry Coyote, we had an administrative hearing with them about 3 weeks ago, and we'd like to see more improvement, and we're still kind of going backwards. And now with this new update with their trainer, we're trying to figure that out. So it's like taking a lot of work just to get a simple thing done, and we're still finding violations there. And Monica's going this week to check to see if he improves, but he knows, like we told him very clearly, that if we don't see dramatic improvement, we have to talk about your food permit and whether we can feel comfortable renewing that, because we don't feel comfortable yet that he could maintain a safe and sanitary establishment. So yeah, so that's where he's at. So he knows he has 3 more weeks to prove that to us before the end of December, which is when his food permit expires. Masala Art has done a lot better. When we got him on watch with his MOU, he's been like emailing us, calling us, getting in touch with us, showing initiative, that he wants to do better and he wants to, get this done. It's not the same with some of the other places. So that's kind of where we're at. So we're going to keep monitoring those establishments, and hopefully by the end of the month, we'll feel better.
Yeah, they've all submitted renewal stuff, and I'm just keeping it on just above the last step before issuing it. We'll review everything. Like I know Rice Barn, he's been improving with his cleaning and everything. He's showing an effort. So we're just gonna have to come down to that decision of whether or not Hungry Coyote can open on January 1st. And I think we still have to discuss how long that would be if they're closed or anything like that.
Yeah, we're limiting operation hours is another option. We've been talking to Berger, Eileen from Berger Food Safety, who's our consultant, and we're like, well, this is the situation with this establishment. What do you recommend we could do? So limiting operation hours is one option. Limiting menu options is another. That way they're not prepping so many items. They can focus more on cleaning, maintaining, a safe establishment. So we'll cross that bridge when we get to it, once we have all our information from that. But right now, we have those restaurants on watch, so we'll see where we go.
My opinion is that we should come down partly with the food department problems with that all.
Mhm.
And they just don't get only way to do it is let them up, close their doors.
I mean, now we've been finding them where every additional inspection, we have to come back to do a follow-up with. So if you can have one routine and one follow-up, which is preventative food permit every so often that we have it. But if we do a third follow-up to meet, to check the first items, then we charge $125. So we've already been adding up some fines. So we're hoping that kind of incentivizes these establishments, because this is serious, you know, I mean, we have to.
I think we need to make a point here.
So we have hope that they'll improve now that they've heard us loud and clear. This is your food permit on the line, so.
Right.
Yeah, I agree. I think coming down a little harder will send a message to everyone. So annual permit renewals are coming in nicely. Still working on currently getting the stragglers in. This week was the first week that the late fee started. So I've been just going through my list and calling the people who are still not submitting anything or haven't submitted anything, but a majority of the food permits have come in, all the hotel permits have come in, pool. Basically, almost everything is pretty solid at this point, which is great. Not sure if there's any other topics that you guys would like us to focus on more specifically. I think the MOUs were the biggest thing that we wanted to discuss for this month.
Yeah, the housing authority, has anything changed there?
So I actually got a response this week from the housing authority. I asked for an update, and they are in the process of getting the contractors to get the gutters added onto those houses that were having issues.
Okay.
And I think now it'll be good because it's at the end of the year, so they're redoing the budget and everything. So hopefully they'll take that topic into consideration and put enough money in to get that done in 22. I'm hoping so.
It is kind of surprising to read. It says the NHA was going to test for mold. However, they were reminded that there is no standard for mold in the state of Massachusetts, rendering the test meaningless.
I think it was just because they've had those tests done before, and they always say that, oh, everything's fine. And I'm like, we don't have anything to say that it's yes or no. Like it's not like asbestos, not like lead, that if it is a certain level, then I'm like, oh, we have to do something.
Yeah.
There's no standard. And I mean, it's about education. I can understand why they would like initially want to do that, because the result's going to be in their favor. But I just clarified that, and that pushed them to get the contractors in place to get more of a concrete solution done.
All right, other questions about environmental health comments? Okay. Next is substance use prevention.
So Karen's not going to be on. I don't know if any of her team members are being on. Karen or. Okay, so I'll give a quick update. One thing is the salsa students went to a training out at Gillette and won $1,500 first place. And I'm not going to be any good at saying how well they did because I didn't see it. But apparently they did this phenomenal informational session. And won first place, probably the office and stuff like that, which was great and awesome for them. Yeah. So that's one thing. And then with Karen and her team, the rest of it, I'll let them speak to. But the one thing to know is on December 1st, alcohol compliance checks were done and Needham had 11 failures. So of the 11, 5, I'm going to push this backwards, so it'll help you if I do this correctly. 5 did not ask for IDs and 6 did, but still served. I think the select board was going to maybe talk about it today, if not, to talk about their next meeting. But that is one key area that her and her team are specifically going to look at. What are other processes that we can help, besides tips, training, that we can provide to the facilities to really work on? How can you de-stress when you're checking on an ID? What are processes at the beginning of your day where you can potentially look to see, breathe, and remember what I have to do while I'm here. So that is one of the big things that that team will also be looking.
Yeah, what was interesting was I ended up going with the police on it, and the volunteer that I was riding in the car with, his ID was actually from out of state, so it was more surprising that they checked it and still served. What I did notice is that his ID, even though it was vertical, I believe it was from South Carolina or North Carolina. On the Massachusetts IDs, it says under 21 until whatever date it is. And when I looked at his ID, his said under 18 until. So I know that confused some of the waiters that they saw that little date and it was in 2019 because he's 20 years old. So it said 2019, so that's why they thought he was of age. So it was interesting, but I would think that an out-of-state ID would be more of a red flag as well. But that was just a caveat that I noticed.
I'm almost more concerned about the people who didn't even ask for an ID.
Yeah.
This is that I feel like, I remember was starting on the board 2 years ago, and I feel like this was an ongoing issue that we kept saying we're gonna try to push the select board to see, if we could improve on this, because if we continue to sell the minors here, and we continue to have super high rates of alcohol use, I think overall for the high school is like almost 30%. If you look at seniors, I think it's more than 50%. So I do think this is something that as a board, we should try to connect with the select board, and see what we can do to improve. What is mostly
No.
For serving?
Mostly restaurants.
Yeah.
Were there any packing stores? There was a hotel.
I think one package store did sell, because the one package store that that my team didn't sell. I think on the other team they did, but it was mostly the restaurants. So, I mean, the volunteer that I was with, he's 20, he had an older looking face, went in super confident, asked for the Bud Light, they gave it to him without checking, so. He's a good
Yes,
volunteer.
so we have the packet, but that'll be the next month because it was technically December. And then the Board of Selectmen did adjust their regulations in August of 2020. So their adjusted regulations put into place, so it'll be interesting to see what they say today, or if they don't, if they wait till next month to talk about it, December. And then they're also going through a new team in the town management office, so working that realm, but I did bring it up to Katie King, our next report, to kind of push it along a little bit, so we'll do what we can to.
Would it be a good idea to have someone from the select board meet with us or maybe to discuss this?
If you like,
Yeah, I think that's a good idea. I mean, that stands in stark contrast to our own tobacco compliance checks.
Exactly.
where, It's
Exactly.
rare if anybody fails, they always check. And, presumably these people look about the same age and, when people go to buy tobacco, there seems to be, a very low threshold to just ask for an ID, but it's clearly not happening.
Right.
In tobacco establishments. And
I really think we need a discussion with the select board.
Our meeting on the 20th, right? 20th. Okay, theirs is the 11th. That shouldn't happen.
There's a lot of new people on the select board too, so maybe the attitude will be.
That's all I have.
Yeah.
All right, traveling meals,
Good evening.
Marianne?
Traveling Meals is moving along quite well. There was an increase of people wanting to volunteer, so I've got plenty of help, which is great. The Community Council, along with the Rotary Club and the Needham Golf Club, provided Thanksgiving Day meals to anyone on the program that wanted it, and there were like 53 meals from our program that went out Thanksgiving, and they delivered close to 300 meals to Needham residents wanting Thanksgiving. And that was free to anyone. That worked out very well. And that's it.
Is that standard for Thanksgivings that we would
Yes, and
provide
Christmas,
about
and that's
300
happening
meals?
for Christmas. It's
Same
free to anyone that wants it for themselves and the guests. And if you had more than 2 people, the community council provided the food for you to cook for up to maybe 6 or 8. I don't know what their guidelines were, but there was a good turnout of people receiving food from the community council pantry. So that's it.
Looks like there's quite a dip in traveling meals. I think from last year.
I can't hear you.
Oh, it looks like there's quite a dip, you know.
Yeah,
100
that-
people less.
Well, a number of people have come off the program. They don't want it. They've tried the food and it's not to their liking and there's nothing we could do.
That's what I wondered. I wondered that if had the food changed or something.
It hasn't really changed. They're really sticking to the contract, the hospital. The cost of food is expensive, and they used to really kind of overload the food. It's right, they're right to the contract, and I can't argue that. That's just what it is. And the Friends help supplement the meal, so that it's available to anyone that wants the meals free if they cannot afford it. There's, but there are other options out there, other home delivery services that weren't there 10, 15 years ago.
But it still remains a lifeline for some people.
Yeah, but we're still that safety piece.
Exactly.
And there are people that don't want that. They are not allowed on the program because we need to know you're home when we deliver the meal. And that's helpful to the families that don't live local. To know
Very
that
helpful.
somebody visits them once a day.
Yep.
Anyway,
Exactly, somebody's checking.
someone's checking. Right, so. Okay, and then I have a comment, not comment, I'm retiring in February.
Wow.
I'm just gonna do it. I love working, but if I don't make a decision, I'm gonna stop working.
You're gonna have difficulty selling your shoes.
Oh, no, you'll find a great person that will be just as enthusiastic and make it work. I'm sure there will be.
Oh, we'll miss you.
You definitely will.
Yes, you'll
But we
find,
will see you in January.
yes.
Okay.
Well, maybe I might want to not come to the meeting.
You can zoom in. We'll still be doing.
So well, we better see you on screen in the 5 years I have worked. So I love it. I love it. Just so you all know, too, Mary Ann has worked here 28 years.
Wow.
So.
Yeah. Yeah, I enjoy working. I just enjoy working.
Well, thank you for
My pleasure.
all of those efforts. Okay. Next up is emergency management. I don't know if Michael is on the call.
He is, I'm promoting him now.
Well, good evening, everyone.
Nice.
So in the last month, we conducted a communications drill for the Emergency Operations Center staff. And that was really successful. It was a drill to test our ability to use the alert Needham system to recall our EOC staff off hours. And everyone on the EOC list responded well to that. So thank you to them. Additionally, I've had one resource request from the fire department for masks. And MEMA was really helpful supplying the PPE for that. So that is still a resource if any of the other town departments need. MEMA seemed more than happy to provide us. They actually gave us more masks than we asked for, which was nice. So they're still providing PPE to municipalities and qualifying nonprofits if you're having supply chain issues or something like that. And then our 2 grants, we got our notice to proceed on Monday for our emergency management performance grant. And that'll be used to fund the hazard and vulnerability assessment. And then we submitted an application for the hazardous materials emergency preparedness grant. That's a competitive grant that we would use to host a tabletop exercise for the entire local emergency planning committee if we get approved. So the deadline for submissions for that was last Friday. So hopefully we should be hearing back soon from EMA about whether we got the grant or not, but I think we should get it. But. Any questions?
How quickly do they notify you about the grant? Typically. Michael?
What was that?
How quickly do you get notified about the grant, whether you were successful?
I believe it'll be a couple of weeks because they do have to score the grant system. So we should know by the end of the month, I believe.
Okay, great.
Perfect.
Any questions for Michael? All right, thank you, Michael.
Thank you.
And I think next is public health nursing. And do we have Mary or Hannah or both?
Mary is here, so I'm gonna put her on.
Hello. Oh, I'm on the screen. Great. So
See the backs of our heads.
It's an inception.
nursing is still an awful lot of COVID, but we are able to do a lot of vaccinations rather than strictly case investigation, which has been great. We are continuing with flu vaccines. We're doing those by appointment in-house. So people who weren't able or missed out on our large scale clinics, we're able to do individual appointments in the office, and Hannah and I are arranging those as people write in or contact us. We are still doing Pfizer clinics, booster clinics for adults, and then we started doing pediatric vaccine also, and that has been taking up a ton of Hannah has done a incredible time with the clinics at the CAF. She has vaccinated a small army at this point with boosters, and they've increased it now to the 16 and 17-year-old age bracket. So I don't see as that's going to fall off anytime soon. In terms of case investigation for COVID, we've got 3 contact tracer positions hired on. 2 of those are primarily for the shared services grant with Medfield and Dover. They just got their Maven logins this week. The 3rd one is primarily going to work with Needham. So we've got a little bit more help to help cover all the case investigations. Hannah continues working on concussion protocols, and I have finally gotten my first case of naloxone in. So we're scheduling our first take-home naloxone class for the 20th of December, with that just being sort of the beginning of the options there. In terms of infectious disease, it's been pretty stable in terms of COVID. I mean, obviously COVID counts are going up, but in terms of all the diseases that we have going on, nothing particularly out of the ordinary has popped up. If anybody has any specific questions, I am happy to field them.
Naloxone program, that's for who is that, those classes for? Families?
I can just barely hear you, sorry.
Yeah.
So Kathleen was asking who were the classes for Monday's class.
So it's scheduled for next week still. So we haven't actually held it yet. It's opened on, it was promoted on Facebook and on the town website. It's really for anybody who needs Narcan or who has, if you have a need to know how to use Narcan, then I want you to have Narcan. And if you have a need to know how to use Narcan and you can get to, and you're in Needham, then I don't really want to limit it to particular age brackets or groups or that kind of thing, because opiate overdose is one of those things that affects all age brackets and economic brackets. So as of right now, I actually don't have anybody signed up, so I can't tell you who it's for because I haven't had any takers. It is still available. And then we'll see if I get anybody to sign up, that would be fantastic. Otherwise, then, try another date, do it again after the holidays and branch forward, but I haven't limited it. So it's open. It was promoted on the Needham Facebook page and on the town of Needham. But I'm not requiring somebody necessarily to be a Needham resident for it. I think that that's most likely who's going to be exposed to that promotion that I've done.
Is it all in person?
Yes. Yeah, it's very short, 30 minutes. You show up, we'll have a conversation. Part of it's how to use Narcan, which is incredibly simple. The majority of it is knowing when to use Narcan and then, explaining that you're not going to hurt anybody if you give them Narcan and they don't need it, but just that sort of training and then providing the actual Narcan itself. So it's less than half an hour. Should be pretty short and sweet. I'm looking into options of being able to provide it hands-free to people who've done the training online, because there's a lot of resources for doing online training. But since we just got it and we're kicking it off, this is all the farther we've got so far.
Mary, will you be offering this again, this training? Is this an ongoing thing?
I would love to make it an ongoing thing. I mean, if I can't find it, like if I can't figure out where the need is, then that's going to make it more difficult to continue offering it. So I do have a case and I'm going to keep going until I at least, find homes for that whole case. And, if that takes 3 classes, great. If I can do it in 1 class, fantastic. So this is really sort of trying to feel out where the need is and figure out how best we can address it. But I have it in hand now. So I'm no longer feeling like I'm offering something that I can't follow up on. But yeah, I would definitely do it again in January and keep going until I hit whatever the sweet spot is in terms of really getting it to the people who need it.
Yeah, I wonder if we could include it in the PIOs and if the news you need have a little section in there. That seems to have somewhat wider reach.
Yeah,
So
absolutely.
I'd ask, are the pharmacies doing this training at all? Because they're required to stock the naloxone kits.
What was the question?
I don't think they're requiring training before they give it, because I've gone twice to get it and just carry it. Do they offer it outside? I don't know that I've seen anyone either offered outside. Have you seen anyone, Mary, offer at the pharmacies the training?
No, so pharmacies, there's a standing order, so you can go to the pharmacy and just get it. But there's, as far as I know, there's no like take-home training program available nearby.
All right, well, we look forward to hearing about your first class next month.
Absolutely.
Right. Other questions for Hannah?
Mary.
Sorry, Mary.
All right. She and I both answered to both names at this point, I think.
Believe it's not here.
Mhm.
But if it's okay with you, Rob, Carol would like to jump on and say some things about her last number.
Sure. Yep. that's
Thanks,
fine.
Mary. Carol is connecting now.
You're on mute.
You have to unmute yourself, Carol.
Okay, I started
There
a
you go.
timer because I'm not going to go over 5 minutes. I just wanted to say I'm really proud of Mary and Tiffany and the nurses for getting involved in the Narcan. And it's difficult to ask for the how-tos in a busy pharmacy. And so many public health departments have become just known that if needed, residents can access Narcan and be able to have a private conversation, whereas the pharmacies are really untenable to do that, especially with the COVID initiative. So watching my clock, I just wanted to say that I'm grateful because with our Mass Call 3 grant, we were able to hire Elisa Dockstader. Tiffany and I interviewed. Elisa is on the call, and I have 2 other things to say, but I'd like to be acknowledge her, and I don't know if she can wave and say hello. She's a BU School of Public Health grad student and worked during the COVID pandemic in a hospital in Utah, and then moved here to work with us, and she'll work 19.5 hours a week as we start to roll out this grant. That's been slow. So I don't know with your setup if you want to bring her on.
Trying to get her on.
Okay. And I'll just keep talking because the clock is ticking. I wanted to say that I've talked and worked with the police, and Tiffany has, and CCIT, and the issues that we navigate with homelessness. And I've reached out to the Norfolk County Commissioners because with the ARPA funds, they held back a certain amount of money. And I asked them about 2 specific initiatives. One would be to put an emergency services social worker in health departments who would like to have them. And I know Tiffany would be one of those. An ES social worker has access to electronic medical records and bed availability. And the other would be standing up some sort of a homeless shelter for temporary housing, maybe 2 or 3 in the county, because all of us in some ways are dealing with this issue and trying to find beds for people, either a DV incident or adult homelessness. So they asked me to come and present to the commissioners. The bottom line is that there was $137 million allocated to Norfolk County through ARPA. And what they decided, and to be respectful, you probably know this, there's a portal they set up, and according to the Department of the Treasury, there's 4 parameters. So each town can go on and apply for simple grants to address these issues. What my goal was, is that the money they held back at the county level, that they could stand up to programs. But basically what they told me is they didn't hold back as much as I thought. And that if towns wanted to get involved in this grant writing process for their community, each town has an allotment. For example, I'm on the Board of Health of Medfield. We got 2 million, I think in 2.1 million. We can write grants. The trouble is everyone's busy and writing a grant is challenging. So I just wanted to let you know, because I've mentioned it before, that the commissioners were really favorable and said, if we could get some towns together, perhaps it could be like a pilot to get involved in these 2 programs. But I wouldn't want to overstep a town and start to delegate what they use their ARPA funds for. Again, I wanted to use the money they held back. So I'm going to keep in touch with them, and I'd be happy to talk to any town who wants to write a grant for that type of a program, because it's already been established. And the last thing I want to say is that when Tim came on board and we wrote the SAPC grant, the purpose of that grant and the way we wrote it was to model after what Needham did with tobacco. And Tim worked hard in the Needham alcohol regs. He got the selectmen to mandate defined penalties for sales to minors as well as mandatory in-person training. For you as a board, I appreciated you mentioning it because those are two things that got in there that haven't been enforced. So even if you as a board would think about what you do with tobacco, define penalties, enforcement, and then mandatory in-person training, I think that would go a long way to letting licensees know it's a privilege and that we don't want to hurt their business, but we want to prevent access to youth. And I'll stop, and there's Elisa, and I just wanted her to say hello and thank you for letting me talk.
Thank you, Carol. Hello, Lisa. Welcome. Questions for Carol? All right, thank you. So we should move on now to COVID-19 update. And I think Tiffany, you're going to do that.
I'll let Julie take the lead this week.
Okay.
But yeah, we're gonna go do it. We've got some vaccination status and
Julie McCarthy, yeah.
Hi, everyone. Can you see me? Okay, great.
Good to see you, yes.
Okay, so I'm just going to give some brief talking points on the slides that I gave. I don't know if it's helpful for me to share my screen or you want me to just go through them quickly.
You could share it, maybe the folks who are here.
Yeah,
can see it.
Yep. Moving this bigger.
Perfect. Yeah, so I'll just talk kind of quickly. We don't have to go into super detail on every slide. But obviously, as is the hot topic, the cases in both Needham and in Massachusetts as a whole are sort of slowly but steadily increasing. If you just go to the next slide, you can see the overall trend over time for the incidence rate and percent positivity, both in Needham and in Massachusetts, is in a slow and steady incline. I think Needham is still doing a great job. Our rates are much lower than the state's percent positivity and incident rate, and we're following a similar trend of everyone, all of the cities and towns around us and on a county level. If you want to go to the next slide, we can skip that too. It's just increasing trend. So there were 147 cases in Needham in November. Again, that number sort of fluctuates. The cases may have been distributed to other municipalities, but as of December 1st, and we're averaging about 4.9 cases per day. We're pretty much at the point where, it's 10 or less cases a day, which is still pretty good. If you want to go to the next slide. The average age of the cases in November was 30.9 years, which seems sort of young, but that's because the cases were largely made up of kids 11 years and younger. If you want to go to the next slide, sorry. If we look by vaccination status, again, you can see that a large proportion of the cases were in kids under age 11. Who are considered unvaccinated by our standards, the majority of whom had their first shot out of their series, but hadn't yet received the second shot. I think that probably has changed by now. And by the time the next meeting comes, those kids will be considered fully vaccinated. So there were quite a few, cases in vaccinated individuals, but I think it's important to remember that Needham has, a vaccination rate of 85%. 85% of the residents are fully vaccinated and greater than 95% have had at least one shot, which is really awesome. But we can see there were quite a few breakthrough cases, really just because the majority of residents are vaccinated. If we break it down by symptom, the majority of people who were vaccinated and tested positive did actually report that they had symptoms, but for the most part, they're pretty mild. It was nice to see that there are fewer cases with symptoms like difficulty breathing, which is not great. If we look state, over the course of the state, the cases are rising, but I think it's important to remember the stats over to the right. 1.6% of fully vaccinated individuals end up testing positive. Only 0.05% are hospitalized and 0.01% result in a death. So the stats are still looking really good for vaccinated individuals. If we look at our unvaccinated cases, again, there were so many in kids under 11 years old. So the average age was actually 15.1 years. I didn't break down the symptom information for this because the majority of cases were in children. I just think it's difficult for them to self-assess in the same way an adult can. There were.
Would be helpful, though, that I have not seen is by population rates for unvaccinated versus vaccinated cases. I know what the state trends are, you're coming up with that, but I'd like to be sure that at Needham that we're not seeing a high percentage of breakthrough to the point where the vaccine is really ineffective, because that could change what we decide to do as public health measures.
Sure, and I think as a whole, Tiffany just did this calculation the other day that I think if you look at all of our cases compared to our population that's vaccinated, I think it was like 1.4% ended up of vaccinated individuals.
About 1.1% and 0.12% of all of our vaccinated cases have had a breakthrough case.
Okay, and about all of our population that is not fully vaccinated, what is their case rate?
So that, yeah, that I do not know. I have not done that.
Okay, that's what we want to see, is that comparison between case rate amongst fully vaccinated and case rate for the unvaccinated, right? Because when that begins to drop, we better. Okay. Thank you.
Yep, I can definitely do that calculation. So there were a handful of clusters pulled from Maven. Not a ton of Needham cases necessarily involved. Again, that's kind of an ever-changing situation. Those clusters may have increased in their number of Needham cases. But at the time, there were just a handful with a few Needham cases associated. And when I went through the cases for November, there were 27 instances of household transmission, which I just counted as being 2 or more people at the same address that became infected around the same time. 16 of those involved 1 or more school-age children. And when I sort of dove deeper into it, the general thought was that the parents were becoming infected, infecting the kids. And then, those are the kids who end up being testing positive at school. Our vaccination rate, like I said before, is really high. I think Needham should be really proud of that. 85% of the town is fully vaccinated and greater than 95 has at least 1 shot. And now vaccines have been available for ages 5 to 11. And as of making this, 80% of them were partially vaccinated. I'm sure that, I think Mary had mentioned that a lot of those kids received their 2nd shot very recently. So that's great. The deaths in Needham, this number I actually just found out today is 128 total COVID deaths. We only have information for some of those deaths just based on what's in Maven and what isn't. The average age is 82.7 years old, and it ranges from 43 to 102 years. The deaths largely that we see are in folks who are 80 plus years old. The school contacts, I think it's interesting to look month to month because it's an ever-changing situation. So in October, there were only 70 school contacts, but in November, there were 307. And those are students only who had an exposure at school, and that's considered those who were exposed in the classroom or at lunch, but doesn't include sports or social activities or anything like that. But the good thing is I could only see that one of those school contacts actually later tested positive. I think this will be a more interesting graphic once the elementary school kids are fully vaccinated. But it's just sort of interesting to see because a lot of those contacts did not actually end up being positive, how many of them were vaccinated versus unvaccinated. You can see, in the high school, almost all of the students were vaccinated, whereas obviously in the middle school, they're all just partially vaccinated now. Sorry, you can skip to the next slide. Just looking at Massachusetts as a whole, breaking down the cases by age, we're seeing, the larger number of cases are coming from the 20 to 29-year-olds and 30 to 39-year-olds. If you go to the next slide and we look at hospitalization rates, the hospitalization rates continue to be the highest in the 70 to 79-year-olds and 80 plus. If we look at the table to the left, we're comparing the hospitalization rates from about a year ago to current times, and can see that the hospitalization rates a year ago were still higher than they are now. Obviously, the rates are increasing a bit here, but especially in the older populations, the hospitalization rates were much higher a year ago. And if we look at children, the hospitalization rates are still quite low, about 2 per 100,000 for kids 17 and younger, and kids actually only make up about 2% of hospitalizations in the state. I think Tiffany wants to talk a little bit about the vaccines, or I can talk about it.
Thank you, Julie. I appreciate it, and jump in if I mess something up. So our total vaccinations to date as of Saturday, well, Monday morning, as we pulled the data, we have done 10,029 vaccines, comparative to our past years of 700 to 800 a year. This is amazing for our team, and I am incredibly proud of what they have done. Hannah is just, as she can gather nurses, she will gather doses and just bang them out as much as we can, the space that's available. So if you look, we have done, at the beginning of 2021, around 7,000 doses is really how the split worked out. And then since our 800 we did of influenza, you add in the other, what, 2,000 something that she's done in a month and a half to get these boosters out to populations and to our 5 to 11-year-olds. If you'll go to the next. These are just our breakdowns of the clinics. This is how this is how Color does it. So the decommission is because I had them taken off because we have so many different site names on them. So that's just what that means. This is the breakdown that we've done as this has popped up, and then have worked with different colleges and things like that. Olin has asked that we might do another one, so we may do some of those. Hannah's got another 200 on Friday. She's hoping to do a larger one next Tuesday, depending on how many doses we have left, and then potentially one smaller version one between Christmas and New Year's. So they are doing awesome with all of that. This is the amount, towns, states, countries that we have done for the last year, but definitely the last several months has increased that as well. And so just very proud of the team. Then Tali, our MRC volunteers, continue to pull through. Christina came to one of our clinics. It was awesome. So yeah, we just have an amazing team, and I'm very proud of the process they've done.
Really an incredible success story with this team of under 5 people, just pulled the whole through.
Yeah, so it's awesome.
So you're not having any problems getting vaccine?
So we will now, like, we ordered 2,200 Pfizer doses, so two things of Pfizer, and didn't see much uptake at all in October. We had 4 clinics a week, and we saw 10-ish to 15-ish people a week. So we decided to cut them down, and then they opened it up to everybody and started to have a need. And at first it seemed like people who only got Moderna only wanted Moderna. So we didn't really see a lot of the same. And now people are being a little bit more understanding about the crossing and needing to get the booster, and that it's okay to get different versions. So now we're seeing a lot of uptake on that. Yeah. ordering the vaccine, we did pull on the holidays. They have like very specific times that you can order and they won't deliver a certain date, things like that. So if we finish off this last pallet before then next week, which I think we will, we may not necessarily be able to get more until after the first. But we'll potentially order more. They also just came out with new Pfizer where you don't have to mix it. So I'm very excited about that. Yeah. So, and it'll be able to be out for 12 hours instead of 6 after you pop that vial. So that helps.
So you could do like a booster for a 16-year-old with this.
We can, yeah. Generally, that's not what we're seeing. But yeah, we can. Because when you go sign up for color, it asks you which doses you had and how many. And then the nurses can see it on the back end. One other thing too, I'll say quickly before we move on to the next portion, it's just that the state is changing their guidance around contact tracing and case investigation. They no longer say that their stance is to call every case, and we do not need to call every contact. So what that means for us right now is we will continue status quo until we make a plan of how to phase that out. But Dr. Brown has said that contact tracing case investigation is only good in the realm of a new disease or a rare disease, and COVID is no longer either one of those. So,
And a lot of people are vaccinated.
yes, yes, exactly. So, and vaccine is the key in this realm more than contact tracing is. So we're working on that process. They did ask that we, focus on certain areas, K through 12, colleges, congregate care, long-term care, daycares, those kind of more high risk or unvaccinated ability populations. So we will work closely with town partners and schools and things like that to make sure that we made a good plan. But the aim is for a plan to be having done by mid-January. That's how we phase it out. Mostly, yeah, it's just calling, because we'll still, so they're hoping in our Maven system to be able to split off and have 2 different actual lists, and one will be under 18 and one will be over 18. So then we can really focus on those certain areas, because the state already mandates like long-term care groups to call them when they have cases, so not necessarily have to call these ones. Thank you, Julie.
Thank you.
Okay, thank you. Questions for Julie or Tiffany about COVID? All right, so, oh, I'm sorry.
Hi, I'm Kathleen in the Center. Tiffany, I just have a question. The newest Mass Health information, it says that you don't need a booster shot to be considered fully vaccinated.
Correct.
I wasn't sure if it's too late. I just wasn't sure if it was covering those graphs, but I'm just wondering about if you think that it's going to change and the push will be.
Not according to the date, not at the moment, no. Yep.
Thank you.
I was noticing the numbers for the Williams School.
For the what?
Williams School, in November, there were 0 contacts. And even in October, it's quite low, 7 relative to the other schools. Any idea why it's so good at Sunita Williams? Is it because of the vaccination system? It's modern and up to date.
Well, every time I ask in our health and safety meetings, they're like, don't say anything because you're gonna curse it. But no, not necessarily, because my understanding is they're maintaining the systems they had last year, which means they were the same across all schools. So I don't think it has much to do with the ventilation. I think it has much to do with the populations that are at the school more, to be honest, just
Really?
what they do, sports, things like that.
Okay.
I don't have a solid answer, but that's my.
I just thought there might be some relationship to the age of the building.
Oh, and Mary just texted me and said Sunita Williams has caught up on cases. So next month, expect to see a change in that.
All right. Thank you. So we'll move on now to further discussion of the tobacco-free generation policy, which we did talk about at one of our previous meetings. And I think, Steve, you were not at that meeting, but we wanted to discuss it again with the president, because I know that
I was
important topic.
Yeah, I was actually contacting some tobacco control folks on another matter, involving the American Medical Association, and they mentioned that Brookline had just passed kind of an interesting policy, and I thought it was worthy of calling it to our attention here, what they did. And, you know, I can see from the volumes that have already been given to us that there's a lot more to it. It looks like they were trying to, somebody was trying to do a whole revamp of their policies that have like 4 major things, a lot of which we already have in our policies. The one that I really thought was more interesting was the very last proposal. Basically, instead of setting an age at which we restrict the sale of tobacco, set a birthday. So that age will gradually increase over time. If for no other reason than, as you just pointed out earlier, with the alcohol compliance, oh, they looked there and the ID said, it was under 18 at such and such a date. There'll be no more of that. We just pick dates, say, January. If you were born after January 1st of 2002, right? No tobacco sales. And that's the only date anybody would have to do. It's an interesting idea because we have gradually, over the course of a decade, seen kind of a waxing and waning of nicotine control. We have gradually seen the number of outlets in Needham has decreased. We did see, the surge of vaping, which came during that time, which gave everybody great concern. And that has been kind of successfully put down. But we were always very reticent to, come out with anything with a prohibition. We thought a prohibition was just not working. And this is kind of an interesting idea because this is basically a phased prohibition over, say, 50 years, where you could see a generation actually grow up without tobacco. And it's not that it won't be sold because people are going to be buying it for the next 50, 60 years. It would just gradually fade out of existence, is the idea. And I thought that was worth discussing because I think there are some merits to that. I think there are some pitfalls to that. I will tell you that the materials that you received, you saw the votes of a number of committees in Brookline, some pro, many against. You did not see the final vote of the town meeting, which I took a look at last night, where this passed by, I believe this is a landslide, 62% in favor, 35% against, and 3% abstentions. An election is a landslide. So it's kind of interesting that they went for it. Brookline currently stands alone in this policy. About 15 years ago, Needham stood alone in a tobacco policy called Tobacco 21. We were the only community in the country that did it, and now it is the law of the land in the entire United States. And I didn't know if this was something that this board would entertain and perhaps join Brookline. This has to start somewhere. Anyway, I thought as I said, I think that there are some, there are some positives, there are some negatives. I thought it was worthy of our discussion. So that's why I called it to our attention.
So, I mean, certainly I can see the merits. I love the idea. And I think there probably would be pretty popular support if it went to town meeting. That's my guess. But the one thing I'm trying to square is, if let's say we pick 2002, then everything is fine for the next 21 years because they will be underage anyway. But then when they become age 22, 23, 30, 35, they are able to do everything else in society, but you're restricting this purchase of this product that's still legal to a group of people that are 35 years old, 40 years old as the time comes. Now, it may be that none of them smoke, so it doesn't matter, but I couldn't really think of another restriction like that, where somebody who is completely of age, i.e. over 21, would not be able to participate in the purchase of something that's legal for everybody else.
Yeah, I mean,
And that's the only thing that I really have a hard time.
Yeah, and it'd be interesting, you have, groups of people where somebody's 45 years old, somebody's 50 years old, and guess what, 50-year-old can buy, 45-year-old can't, and what's the 5-year age difference once you get to be at that age? Right? As I said, I mean, there are nuances to this that, I'm not sure everybody has thought out.
And it's my feeling that probably if you've reached the age of 21 or 22, and you haven't acquired the habit, you're not gonna do it ever. So you could argue, yeah, okay, so somebody who reaches the age of 40 who decides it's cool this month, well, I like it. And should we prevent them from doing that? They're 40 years old. They're not kids.
No, they're not. We prevent other things. This is one that we, have really good data in terms of the cons and pros of the activity. And there are costs, not just to the individual, but to society. Somebody is paying those medical bills. Somebody is paying for productivity, right? And Hawaii right now is considering increasing the age to 25. New Zealand actually has currently in legislation exactly this proposal from Brooklyn, talking about creating a tobacco-free generation, and that legislation is expected to go to the vote next year, which would make the entire country tobacco-free over the course of a generation. So it's out there.
But the 25-year-old sort of cutoff makes a little bit more sense to me in terms of some of the science we have in terms of when you have a fully developed frontal lobe. And, I think that's what we've been learning over the last decade or so. And I think there's sort of a valid reason to maybe potentially restrict up to that age, but then, beyond that, just the right to buy a legal product as an adult. And, if we were to do this, it would be a moot point for the next 21 years,
Well, no, I mean, if you were to do 25, that you could do very quickly. That would be 4 or 5 years. You pick a date where you have people who are like 20 now.
Oh, I see you say that.
Yeah, exactly. So I mean, it won't be moved for 21 years. So 21 years from now, 40 years, it's going to be fine. But if you said, hey, we're interested in 25, you might want to do things. But we did not do that as a town. I have no idea how Hawaii is proposing to do this, but I agree with you. I think the science, just in terms of, to hit the point where, developing brain is unlikely to pick up the habit, 25 makes more sense than 21 from that standpoint.
That was the logic that Belmont used when they used to purchase cannabis 25.
Yeah, I mean, I think I would echo similar sentiments. I think I could, get behind raising the age of purchase. This particular idea, I mean, I think it has merit in that, it can further reduce the public health burden that smoking has on society. I think there was someone in the Brookline in town meeting who said something like, if we calculated the cost that smoking has on every resident of Massachusetts, basically we would each be paying something like $900. And so it does have a societal cost. And we regulated smoking in public places. But I think still for some vulnerable populations of children in the home, who have disabilities, there are still places where people might be exposed to secondhand smoke. And so this generation also could have a positive impact there. I think right now with kind of the temperature of the country, I don't feel this is the best time for something like this. But I do see some of the merit, and I think it would be easy to actually get behind raising the age to 24, 25, whatever.
I'd rather see us look at raising the age to 25 and see us looking at this policy here. I mean, I always said it'd be the greatest state for public health in Needham, but the last tobacco permit doesn't get renewed.
Right, I mean, that's the other approach that we could have in Needham is to, continue to phase out tobacco permits.
Just make them harder and harder.
But I think also it's important to think about kind of who's, what's our, especially amongst our children who's smoking. I think the smoking rate amongst our youth is 2.9% as of 2018. And, we just administered the Metro West Adolescent Health Survey this past month. So we'll see in 6 months what our current smoking rates are. And vaping rates and, all these things.
I agree, because when we looked at this previously with restricting flavored tobacco, the vendors reported that they never are checking a Needham license when they're for purchasers. It's pretty low smoking incidence, so necessarily impacting our own citizens, and the fact that you can go to the next like the drop-in license, for example.
In Brookline, how did it, there was, it wasn't initially supported, but then it went to town meeting. Was there a group in town that sort of championed that?
Sure, the citizens position is just, I believe, I don't know all the details. Sounds of the recording today, sounds like it was a citizen petition, which was then reviewed by the select board, the Department of Health and Human Services. They have some sort of an advisory committee. I'm not sure what that is, whether or not that's, that's public or not, but I'm not sure what that committee is. There's pretty robust discussion of that. And then ultimately those groups took a stance pro or and then it went to town meeting where it was, I mentioned, pretty resoundingly adopted.
I guess the other sort of issue is compliance. As people get older, we do pretty well with tobacco compliance checks, not so well with alcohol compliance checks, but once people are like 30, 40 years old, you just have to card everybody, I guess. And
They should be carding everybody now.
right, but that it's got to be enforced by somebody, and it becomes a little bit more challenging. I think that was one of the things that they raised in Brookline.
Yes.
In opposition to it.
I wasn't expecting us to, to have any sort of formal vote or anything like that. I thought, because they said, I think it's working discussion, as we continue on this road, it sounds like, people might be interested in, supporting ages. Maybe getting more information on this, maybe not, but I thought it was worthy of the discussion once this group was able to back control.
Yeah, no, agreed.
Well, is it possible? Has anybody talked to anyone from Brookline, Board of Health in Brookline?
I have not.
I mean, maybe we could have like someone from the Brookline Board of Health, maybe recent.
Okay.
All
right.
So when we speak also, can everyone speak a little bit louder? Because I'm getting feedback that people aren't hearing everything that's being discussed.
Okay. All right, next up, we're going to have a guest Micah Burnett. Micah's here, right?
Mhm.
Speak about controlled substance decriminalization. Micah is I'll let him introduce himself, but he is a Needham resident who's currently, I believe, at UVM. And I think he'd like to talk about creating healthier communities by proposing change to controlled substance laws, specifically involving entheogens, which are better known as psychedelics.
So I would just like to point out that we do have a hearing or an open comment section starting at 2:30, so we've got 10 minutes.
At
Hard
8:30.
Sorry, 8:30.
Yeah, so
So we have a hard stop at 8:30.
okay, so I think we talked to Micah about 5 minutes, and we can have 5 minutes after that instead of 10.
Sure.
What does that sound? Okay.
Hello.
Hi, Micah.
Hello.
Hi. Sorry.
Hi, we can hear you.
Can you hear me? Okay. Sorry, I just
Yes.
wasn't sure. I'm trying to see if I can get my camera on, or is that even an option for me? Or no?
Trying to promote you as a panelist. Just give me a second, but if you want to
Okay.
start talking.
Here, yeah, I can join as a.
Okay, rejoining. He's coming in now. So we'll have the camera. Micah, you should be able to turn on your camera now.
Wonderful. Hello.
Hello.
Thank you so much. Thank you for the introduction. So yeah, I'm a student at UVM in Burlington, and I guess just to give a bit of context, I've been involved in organizing 2 student organizations starting this semester, the UVM Psychedelic Science Club, as well as UVM Students for Sensible Drug Policy chapter. And I've had meetings with the Burlington city councilors and social workers who work up here who have endorsed this. And I would see a resolution being passed in Burlington probably by the end of this upcoming school year regarding decriminalization. And also, I noticed that there's a free Narcan training going on next week, which is awesome. Hopefully I can be there. So I guess I'd just like to start presenting. I know we're a little short on time, so I'll go quick. So recently I was tabling for this issue in Burlington on Church Street. And I had met somebody who had come up to us to speak. His name is Anthony, and he had just spent his first night ever sleeping on the street. A very difficult conversation to have with him. He had been clean from opioid use for about 2 years now, but he was addicted for a very significant amount of time, lost his job, his family, was in prison for some time. And this is not a rare story at all. He told me that the fact that addiction and drug use is so stigmatized, he found it nearly impossible to seek help. And the fact that he had been incarcerated made it extremely difficult for him to find a job. And just bringing this to decriminalization, a quote from the doctor who revolutionized the policy that's actually been used in Portugal for the past 20 years for decriminalization. He said that the biggest effect of decriminalization have been to allow the stigma of drug addiction to fall, to let people speak clearly, and to pursue professional help without fear. So the different European organizations have seen social costs, spending on arrests, both decrease, transmission of HIV and hepatitis decrease significantly, and addiction and drug-related deaths decrease since the implementation of this. And there are very similar outcomes in smaller localities around, like in Burlington and in different cities that have implemented harm reduction social work centers. And that includes having free pipes and syringes and needles in safe use sites. And that has significantly decreased addiction levels because it allows us to have open conversations, but also overdose levels have significantly dropped in those areas. So there's a lot to back this up. So here, I guess I'm just asking us to see the bigger picture, because I know that Needham individually as a community does not have a notable problem with drug arrests. However, it's very short-sighted to think that we're separate from this larger scale issue. And even the fact that we don't arrest people frequently on drug charges. However, addiction and trauma is everywhere and affects the people we know and love, and people who we would not expect. So I am just asking for your support, and asking to start the conversation with this in Needham and in town hall. And if Needham as a town publicly supports this, that will have rippling effects on neighboring communities. Right now, Newton is considering a resolution to decriminalize. Boston is formally proposing a resolution for this in January, which is very exciting and will most likely pass. And it will just open our town up to these conversations surrounding real meaningful harm reduction. And at least from my personal experience, that will hopefully bleed into the high school, where we can have complete and meaningful conversations around drug use, where in my experience, I went to the high school and graduated in 2020. We did not really have a complete conversation in that area. And as discussed earlier in the meeting, we were on the forefront of tobacco policy, and it seems like we're continuing to be there, promoting safety and harm reduction in that sense. So why not be on the forefront of undoing the harmful stigmas surrounding drug use and promoting harm reduction? So thank you.
Thank you, Micah. So we only have a few minutes before 8:30. When Micah first approached us, I think he was framing the conversation more around entheogenics, which are psychedelics, which may have a role, we don't know, in the treatment of PTSD and depression and anxiety. We have, I think it's important to our board to think about it, because we have increasing rates of depression among younger people, and treatments that we have don't always work. So decriminalization of these substances can lead to potentially better treatment for depression, better management of substance abuse, or managing substance abuse as a public health issue rather than a criminal issue.
Can I just add, what is the ask here? And maybe Micah, what are you asking this board to do?
Well, just being the Board of Public Health, I just want to have these conversations with you guys, get your opinions. And additionally, like I've been working with a volunteer group for the past year and a half, and we've put together a specific resolution for decriminalization. And it's been passed in many cities in Massachusetts, so I'm not exactly sure on the specific process that it would have to go through to be supported in a town. But yeah, it's essentially just asking for the support on the specific resolution, which would decriminalize these psychedelic plants for growth and use, and also deprioritize all possession arrests of a specific amount without intention of selling for other drugs.
Do you have language for us to consider?
Yeah, I do. I can send it in an email right after the call.
You know what?
We have-
But that.
Yeah, I
it was
should.
not part of this. Yeah, it was not part of this meeting record, so it's not in this agenda, actually.
It's not in the packet.
It's not in the packet, but yes, Christy and I have seen it, and I think it would be helpful to circulate it to other board members for
I'd be very
consideration.
interested in seeing that I have significant reservations about broad scale decriminalization.
But I
Sorry.
thought it was. Go ahead, Michael.
I was just having a hard
Hear
time
what Ed's
hearing.
If you could repeat what you said.
Reservations about, broad scale decriminalization. If you want to target certain substances, maybe, but not just everything.
All right, so maybe we should leave it that the information, Mike, if you have additional information to send us.
I mean, I can always send information if you guys like. So after this email, again, I can resend the specific resolution and the language, and I can include some informational sheets as well.
All right, and Tara, anything that we received before could also be forwarded to board.
Okay, that'll be good.
Okay. All right, Micah, thank you for your presentation.
Yeah, thank you so
And
much for your time.
we look forward to getting your other materials.
Absolutely.
Okay, so it's 8:30. So now we're going to move on to the continued discussion of the property at 1688 Central. And we have 30 minutes allotted for citizens' comment. There's a lot of people here. I thank you all for coming. And we would like to hear what you have to say. We have planned to allot each person who would like to speak 3 minutes, just so that everybody has an opportunity to speak. I think, do we have a list of people who want to speak?
Yeah, so I'll keep a timer, and then we'll also ask the board to hold your comments until the end after everybody else has theirs as well, and then you can discuss and make your determination after that.
Okay.
All right, so first up, I've got Holly.
Thank you very much for giving us this opportunity. And we did share some material, but we also just moved some pictures up because we weren't sure you would be able to get the material. The big red flag that came up was
For the record, does each person have to introduce themselves?
Sure. I don't actually know what needs to be on record, but that will be helpful.
Yeah.
Sure. I'm Holly Clark, I live at 1652 Central Avenue. So the big red flag that came up most recently was when we learned at the planning board public hearing that the seller of the property did not permit potential buyers to do due diligence environmental testing. That was information that we hadn't known before. And as things have come forward, what is clear is that this wasn't just a single family house that had an above ground oil tank, but instead functionally, this property operated as an automobile junkyard. It operated as the repository to an excavation company and their debris and their material, their machines that they presumably maintained while they were there. There was an unlicensed auto building that operated apparently in the barn, and there was also another barn that was taken down before. And they also had automobile repair there, and there was a lawn maintenance company. All of those separately create environmental issues. And there are two different DEP programs that would be involved. One is the oil and hazardous waste discharge. The second is solid waste containment. And what we learned, and what you can see from the global images that we submitted, is this was decades long. This is not an issue of like one old car that sat there for summer or not. From the things we have from residents just over the last week, this was like 50 years of what went on there. And it was just like folks that this is what they did, this is the time that they did it. This one we pushed up here just shows what it was like in 2008. This is the barn. There's material all in here, which is where the construction is planned. And then also it's around the site. And the individual pictures we have is just, there was a high school kid who went and had a dad's camera and happened to take pictures. And when his family found out, that people were interested in the site, he said, "Oh, you want my pictures?" That's what's here. So you can see up close what there was when you look back here. So the 2 points quickly to say is it was years long. And secondly, it's around the entire site. One of the things I learned in looking at this apparently this property had a cesspool, it wasn't connected to the sewer, so that was discharged. Stayed on the property here, and as I understand it, this is where the cesspool would be, so that's where the construction is planned. So,
All right, yeah, we've got to move on to the next, who I believe is Christie.
I wasn't finished, but thank you very much.
Thank you.
First, I just want to say that I want to say that I'm sure this is day, never having known the background of the site, would have thought we'd like to know a little bit more about what was there and what's going on. And these are things that we just happen to find on our own. And I'll be a hard time hearing a lot of help. Also that I imagine that the parents that are also involved in the site also don't know what's the background. And we, the neighbors didn't know until we got around and found it. So that's where that comes from. For those that are aware of what's in there, and maybe don't know the result of what happens when you have all that. Oh, thank you. I'm not very loud, so thank you. So again, Holly talked about all of those items that were there. And in the packet that I provided to TAR in Appendix F, we're going to see a list of all potential contaminants that come from all these different types of sites. This is also in Table 1 of the packet that Holly gave you. This packet that I've given you is from the CDC. It's guidance on what a manual for safeguards needed to ensure sites in an early childhood education center is looking to build on the site. So there's information there that I discovered only this yesterday because we're looking through trying to see what is at the site using the GIS, the Geographic Information Survey. So that is one of the recommendations that's in this packet that you'll find. If you go through, you'll see on the orange tab, there's a list of actions to be taken. First of which is to form relationships and also learn about what's on the site using GIS. And then there's a number of other things that involve things like phase 1 and phase 2 and environmental examination. If you look, there's a blue tab that also shows what the safety concerns are for all, again, of the different types of things that the site is used for. And again, I'll reiterate that just because it's not there now doesn't mean that the contaminants aren't there. I told you before about how long lead can be there, 2,000 years, but also oil spills 20 to 40 years. So if that happened, it's still there. And then lastly, I'll draw your attention to the yellow tab, which is a case study about a daycare that was built in a building that had mercury that nobody knew because nobody knew they had to do anything about it. Basically just kind of lays out that case study of the harm that was done to those children as well as the loss that followed after that. So I will leave you with the packet. It's not the complete packet, but I did email it because it's 115 pages long. Thank you.
Next we have Abby. I'm sorry, I forgot your last name, so no. Oh, I'm sorry. Abby.
Sure. I'm Maggie Abruzzi, and I'm at 30 Bridal Trail. The preventative remediation suggested by the developer is wholly inadequate. They do not conform to any scientific standards or accepted environmental practices. They do not meet the range of environmental issues presented at this site. The developer suggests testing only for lead and testing only very shallowly and only in spots that they decide the day they go there and they see what they want to do. There need to be standards for what's being done so that people can have confidence that we are fully investigating the environmental impact of all these years of very environmentally risky practices at the site. The things suggested by the developer are merely performative acts designed to try to remove the property from scrutiny, not to actually address the environmental concerns present. The suggestion of putting no permeable stone fencing down is not a barrier that will protect anyone
from the spread of anything on this site. And putting 6 to 12 inches of fill is not adequate to protect anyone. The board does not allow the developer to designate the scope and methods of testing or the scope and methods of remediation. All testing should be done by a licensed site professional and should be conformed to the appropriate industry standards. The board should require that a licensed site professional review all materials submitted to this board regarding the history of the property so that they know what the potential hazards are. All remediation should be in accordance with state and federal laws. The known history of this property is a huge red flag. It's a red flag the seller would not commit environmental due diligence. It's a red flag the developer submitted a plan to the Department of Health to have a septic system. But then when his engineer did testing, he abruptly decided to bring the sewer line in. It's a red flag that the developer used a person who's not a licensed environmental professional to dissuade the bank from requiring a phase 1 or phase 2 report. It's a red flag that the developer brought fill of unknown origin and spread it around the site after the environmental issues were raised by the neighbors and by this board. It's a red flag that testing and solutions the developer proposes are merely performative. Given the overwhelming evidence of the potential for environmental hazards, the red flags raised, and the developer's position within Needham government, we ask that you hire an independent environmental expert to oversee this process and ensure that all future daycare occupants, the neighbors of 1688 and the town of Needham are truly protected from environmental hazards. Given the overwhelming evidence of the potential for environmental hazards at this property, we ask that you share all the information you have gathered with the Mass DEP and the EPA.
The time tonight. My name is Joe Abruzzi. I'm also at 30 Bridal Trail. Just want to make a couple of comments. Obviously, you see the photos here of the history of what was on the site. That's certainly very concerning and disturbing. But I think what's even more disturbing are some of the things that have been said and have happened recently with the site. So, when some of these conditions were brought to the attention of the Public Health Division, Tim McDonald, the Public Health Director, said, historically we found that many businesses like this didn't properly dispose of chemicals, especially in the pre-2000s, the 80s, the 90s, and certainly the 70s. A lot of times it was just, quote, dump it out back. So we did recommend this sort of extra level of scrutiny to the Needham Planning Board. So I think there was some acknowledgement here that there does need to be some additional investigation. There's some other concerns too. When this property was for sale, the seller refused to let interested buyers conduct any soil testing. We know that the temple was interested in the property, and the temple wanted to do soil testing, and we were denied doing the ability to do that testing. As Maggie said as well, when the developer got a mortgage for the property, there was not an environmental test done. He hired a consultant who's not certified to do any environmental assessments, to issue a statement that tests were not necessary. The developer also put some fill at the site to cover existing conditions. Again, that's a red flag to us, covering up some issues that were there. So to date, there's really been no testing, no publicly available reports, and nobody knows what's in the existing soil. So what I do ask the board is to require an independent test. Know what's in the soil, know what toxins are there. We have a child center going in, and it's our responsibility to make sure that it's being built. And the planning board is actually looking for the recommendation of this board in its decision when they're trying to decide what to do with this permit. So I ask you to consider all those factors. Thank you.
Board for having this process.
I'd like to thank the board for having this conference tonight, and I want to thank everyone for coming. And I do believe that, have to believe that everybody does this in the best interest of the town and children. So in that respect, I would say that I know that the person developing this program will go to the utmost for children and families, and that he would take any recommendation for seriously. As we've done in the past, that's what I just think. We do the same thing for the children's side. We want what's best for the children. We want what's best for the town. We want to have this building be safe for the children. So that's our goal. It's as simple as that. But we went to the board for their recommendations and going by their rules and regulations. And you'll give your account to the planning board process. And I think that's the important thing. And then I think neighbors are very important. And I've always said that, and we would work with the neighbors. And every single one says that they brought up all of them. That's all. Thank you so much.
Next thing, we are.
Yeah, that's me.
Okay, sorry.
No problem, it's Greg. Hi, my name is Greg Garris. I'm at 34 Country Way. My house is right here. My children's playground is right here. For 15 years, this is the view from my children's playground, right here. My children knew they weren't allowed to go to our property line because of all the contamination. So my biggest request, and I really implore the board, please, we need a independent licensed professional guiding the town to protect our town, protect the kids in the neighborhood. Right after these complaints were made and the concerns were brought to the attention of the Board of Health, I watched for almost 2 weeks as a whole crew of earth moving equipment, bulldozers, dump trucks went through here, digging all the ground, stirring everything up, dumping fill. And I have photographs of that I took today. The piles and piles of fill and holes and everything that was stirred up. I assumed that was you folks that were overseeing that were requiring that as part of the cleanup. I only found out about a month later that it wasn't done under the supervision of any health professionals or environmental professionals. This was something that he apparently did on his own right after the complaints were made. That makes me extremely concerned as a resident. Anyway, those are the only points that I wanted to bring. Thank
you. I'm an environmental consultant. Can you hear me now? I think it's shut off. Can you hear me now? I'm Rick Wozniak. I'm an environmental consultant that became by Mr. Borelli to help me navigate this process of trying to determine if the sample, what the sample for, based on experience, qualifications. I am a licensed professional in Massachusetts. I am a professional engineer in Massachusetts, as well as a certified hydrogeologist at the American Institute of Hydrology. I've been doing this a long time, and the contaminants that everybody has been talking about in the method that I've heard regarding the release of these contaminants are sufficient. There are no underground storage tanks. There are no knowledge of a pit or a cesspool or anything like that of dumping in that type of environment. So that's the reason why we have done shallow soil sampling. The reason why we decided to do lead sampling was for the purpose of understanding what exactly happens when lead-based paint from a house that in the early 70s ends up having lead in the soil. So that's why we tested the soil. The situation is such that because we have corroded cars doesn't necessarily mean we have contamination in the environment. Oil is a non-persistent contaminant which degrades naturally over time. Lead is not. So that's why we decided to test for lead. And the final reason why we decided to test for lead wasn't so much for the purposes of protecting the children, during the daycare operation, because we decided we're going to cap everything to begin with, which you all saw from the standpoint of what DEP's protocols were, as well as the Environmental Protection Agency, and that's a common or suggested or recommended practice by those agencies. So again, the purpose for the lead testing was more because of the concern that was brought up with respect to the construction activities and any dust that may be generated that could escape this site. And again, that would be a sufficient type of release or concern. Thank you.
I think moving forward, because I'm getting comments that it's hard to hear them, is if they can just sit in this chair to be closer to the main microphone and just enunciate what you're saying, so everyone can hear.
So that's everybody I have on my list as far as that's signed up. We can circle back with a couple more questions. I'll make it 3 minutes again, each person, so you have another 3 minutes, or you go, Mr. Chair, you okay with that?
I'm okay with that. Yep.
But it sounds like we don't disturb, that there be no movement when others are making their statements. In fact, it's not fair to anybody to have people up and going around. Thank you.
Thank you very much. I really tried to, I timed myself ahead of time to try to stay with 3 minutes in. It didn't work. What I simply wanted to add was the issue of having an independent person to advise the town is really, really important. And in researching this, apparently it is standard in other towns. You would just go, they could work with the developers, people for sure, but the person that would guide the town would only be concerned about the town and the town's residents. Next door to this is the temple right now has a playground and has a preschool and has school. There are families that live all around here that have their own children. And this information simply is beyond what's in the house and the lead and asbestos and whatever is there. That's an issue too. And the expert that the town could hire could help with that. And Mr. Wozniak did say to me later, there could be meters put up to check if the wind is going too fast. You could have a meter measuring, is lead going offsite? But that's about the destruction of the house. These are different issues that frankly, we didn't have the depth of it here. Yes, it is true, seeing an old car doesn't necessarily mean there's a problem, but auto salvage yards are highly regulated. And there's laws that say it can't be within 300 feet of another playground. The Temple playground is right there. I'm at 300 feet away. So we have here evidence to have enough just to get an expert to guide the town. We don't have to assume the conclusion, but if you have an expert that guides what goes forward, everyone will have more confidence in what's going on. It's not a matter of not trusting Mr. Wozniak. Maybe it's trust but verify. So that's really what the ask is from the neighbors, to give that guidance to the planning board to say, just get the expert like you would do for any project like this, for any developer like this, and especially here, so that it's just, people can trust. And this is, look at the pictures. I mean, GIS pictures from 1999, from 2009, from 2019. You have 30 years of piles all around this property. There were oil barrels back on the neighbors. Greg Korinsky said when he bought his property in 1994, the oil barrels were on his property. And I would suspect it is not somebody that's using them, on their construction sites. You don't put it 3.5 acres back there. We have statements from neighbors in 1 week saying, well, I saw lots of fill come in and come out. I saw containers of fluid. It deserves to be checked. And I'm very happy to hear Mrs. Day say, of course she would agree with that. So our ask again is just to say, get an independent expert here to protect the town. Thank you very much.
Right, we've got time for both, so we'll do, and then,
I'll be very quick.
okay, yeah, I was gonna say, I don't know if I did 3 minutes, but.
Okay, I think it's important for the town to find out if there has been a phase 1 and a phase 2 environmental assessment
from a licensed site professional and/or evidence of site closure from the Mass Department of Environmental Protection. I think it would be typical for a developer, particularly one who proposes a daycare, to undertake a full environmental study before proceeding with a project. This kind of report would discuss whether there's soil and or groundwater contamination at the site, and if there is, trigger a cleanup process in accordance with the Massachusetts contingency plan. So we're asking you to hold this developer to standards, a phase 1, a phase 2, overseen by an expert that's appointed by the town to be independent. Thank you.
Rick and then Pat.
I guess the last thing I'd like to leave you with is that
If we could come to the chair, just
the
because.
last thing I'd like to leave you with is that we are going to, or Mr. Borelli's construction folks are going to cap the whole property. In other words, anything that could be there, that may be there, even if you did a phase 1 and a phase 2 environmental site assessment, there's no guarantees you're going to find what you're looking for. And so the purpose of the cap is to eliminate any exposure. And again, that is something that I provided to Tara regarding DEP's recommendation, as well as the EPA's recommendation. So I use it, the analogy I like to use is you get to a certain age, you go to your doctor and you say, I want to get my whole body tested for all the types of cancer that's possible. The doctor's going to say, well, what are your symptoms? And you're going to say, I don't have any. And they're going to say, well, that's unreasonable. That's kind of what's happening here is there is a lot of possibilities. And for us to test those possibilities, I'm not even sure what I would test for other than I hear petroleum and lead from lead paint. So the capping is still going to occur independent of what we do, what is found for the purposes of protecting anybody from anything with respect to what's in the soil. And lastly, the fill that's been brought in, the fill is loam. And that loam has been there and it was from another site. And that loam, I told him, if you're going to use it on the property, test it. If you're not going to test it, take it off the property. It's good loam, he could sell that loam. So that is the fill material that I understand was brought into the site. Thank you.
I have a question. Are you saying if we cap the property, we're going to cap the whole property? That's all 3.5 acres?
The construction area of the facility, so the daycare facility.
Not the whole property.
No, just the facility, the kids are going to be present.
When you talked about capping, does that mean all vegetation is removed and then the cap is put on?
So when we talk about a cap, we're talking about a cover. So originally we recommended, in the capping is, the type of capping, the thickness of the capping, what we put down is dependent on who's going to be exposed, in this case, children being the sensitive receptor, as well as the intensity of use. So you get natural caps, which are going to be the building, the paved surfaces, sidewalks, and things like that. You have other landscaped areas that are going to be covered with 6 inches of loam, and then managed maintenance-wise, whether it's cutting grass or planting trees and maintaining that. The playground area, that's the high-intensity area for the purposes of requiring or recommending a thicker cap with a demarcation barrier, because kids are going to be running in it, digging in it. It could wear over time, so that was where we had a larger thickness of a cover. It's not like an impermeable capping barrier that you'd see on a landfill or something like that. It is a cover so that the exposure from kids, the exposure is ingestion of dust, ingestion of soil, that eliminates that. The cap or cover eliminates that. It's inhalation of dust. The cap or cover negates that. And then there is dermal contact. The cap or cover would eliminate that as well.
No, I was thinking when you cut the cap, like what we had to do years ago with the town, I'll call it junk. And we capped that, it was a landfill. And that was a significant project.
It is, and that's a different type of cap. That eliminates water from infiltrating down through it, so you have to deal with runoff and things like that. This will be it's a cover that will let rainwater infiltrate through for the purpose of eliminating those exposure pathways from any soil that exists on this property right now.
Thank you.
Yes, I just like to say one thing, and that is that I've been going through this process for a year. And I think everyone in the planning board here is doing its due diligence. They're experts in the area.
Sorry, Pat, not to interrupt you, but can you please come to the front? People can't hear
You
you.
know, everyone's done their due diligence. I think I want the children to be safe, but I also want these boards to understand that they do have expertise, and people come here for you to make good decisions in the best interest of the town and the community. And so that's all I want to say, is just that I believe in the process, and I believe in these boards to make good decisions for the property and for the town.
Thank you.
All right, so it is now 9 o'clock. Open public comment, and then correct me if I'm wrong, Tara, the planning board would like a decision tonight, or as they are needing to make their decision on Thursday.
Right, yeah, Lee said she needed that by Thursday the latest.
And to be clear, the planning board is looking for a recommendation from the Board of Health as to what should or should not be done.
Right.
Health-wise. Discussion?
Yeah, I mean, I'll start with just saying, thank you to all of you who came, who took the time to write these letters, share all this information with us. I think from our last meeting to this one, there is quite a bit more information that has come to light. I think, these photographs, these accounts of neighbors, it's quite a bit more than I think what we had last month, which was that the public record from Needham Fire, that from 2003, what they observed when they went there. And so I think, hearing from Needham Fire, we had noticed that they were going to visit that site, and then went 10 days later. I think the observations of all these neighbors, dozens and dozens of neighbors, we've received dozens of, at least 30 letters from different neighbors, tell a little bit of a different story. And so we're hearing and seeing photographs of decades of potentially auto repair, that looks like maybe auto storage. And we know there was some race car, stick car assembly there. There were oil tanks there, and the fire said there wasn't oil in those tanks when they went there, but we know there were some very large oil tanks there. The barn was being used by landscaping companies, so there's a really wide range of use of that property. And so I think for me at this point, I do feel as though we do need some further testing of this site before building a facility for children. And I think it is also concerning that, after our recommendations this past spring, that there was fill brought there, and I don't know, was it just put there? It sounds like from neighbor, perhaps there was some excavation and then it was put there. So that is really concerning also. And so I think we all want to do what's in the best interest of children, of public health. And so from my perspective on this particular issue, I do think we do need some further testing.
I had a question for Mr. Womack. We talked about the different, I understand your point about capping the whole, if you cap the property, no matter what you test for, you're gonna make things safe for the people and children above. That's the idea of the cap.
The
But
idea is to eliminate any type of direct exposure to the existing soil that's there now.
But I know that, having read all of the comments and letters, I know that there are concerns from residents about the groundwater. And it doesn't sound like that cap is the same type of cap, say, that was used at the transfer station. And I just want to get your thoughts on that or comments.
Groundwater is not a drinking water source in that area, so there's no exposure for anybody in that region, including the daycare, to groundwater. That's number one. So the facility is going to be on a public water supply, so groundwater is not exposure. We call it exposure control in kids. How they were consuming water. The second thing is the types of contaminants that are metal, asbestos, heavy oils other than gasoline, don't typically dissolve readily. So groundwater is typically, especially for lead, not a groundwater impact, because it doesn't solubilize, it doesn't dissolve. So unless you were to have like a gasoline contamination, which you would see and smell, not only be really disgusting, if there was such a time we saw that type of contamination, it was significant enough that it could actually dissolve into ground. And again, gasoline and these other constituents, EPA calls them non-persistent in the environment. So they degrade naturally over time due to volatilization, bacteria degrade them, spreading, and things like that. And so they go away over time.
Thank you. Pete, one quick comment.
Yes.
Thank you. That property is elevated just above mine. All the water flows directly, literally into the playground, right into my backyard. All I ask is that it be tested. That's all. I need that's all I'm asking.
Yes.
If you have to track the entire expanse of that property, then you have a net source state with and any kind of anything that's happening over there that you don't have is going to go back on the kid. And that's created a recommendation that you have to consider nearby sites as well as actual sites.
Thank you. Thank you.
So we've run into this problem before. This is not a problem. We've had environmental hazards in this town. And, I seem to recall, the electrical lines from the Eversource going, on the sidewalks was the last one. And we actually, as a board, requested funding from the town so that we could hire independent experts when necessary. I don't know whether the cap is the right solution or not. Maybe it is, right? But this is an issue, I think, more of conflict of interest. I think the petitioners are correct that we should have an independent look at this. Now, it may be that the cap is correct and no further testing is needed. But, just as I don't care to have, Eversource's health physicists tell me what they think, or Verizon's, and we want to have an independent look at that when they come, I think the same applies here. Even if this wasn't being built, though, I think that, I'm not sure how we deal with, environmental sites. You've been letting water run into your property from this for years. Why the complaints now? Why not years ago? And I would note that this is pre Walker Pond, Charles River, the Charles River area. So there could be, more far-reaching environmental impacts. Shame on us for not getting to this years ago if you folks knew this was going on. But I do believe that, having an independent look to address all of those issues and other ones we might have even thought of, I think is important.
See, I think I agree with you. I think we do need an independent look, and I think we do need to request that either we as the Board of Health or that we and the planning board request funds from the town to hire. No, not disparaging for environmental people, but just somebody the town has towns interest. who look at this property. We're gonna put, children out there, small children, not teenagers. And I think that we need to take every precaution necessary and so to protect them, but also to putting that center out there. What happens in 20 years when something turns up and I say, oh, yeah, well, the Board of Health 20 years ago said it was okay when this issue was raised? How does that make us look 20 years ago? I mean, shame on us. So I think we should work with the planning board and request an independent, separate testing on this program.
Because it may be that they come up with no testing, cap would cover it, and that's that. But
Maybe that's the solution.
Right, but I think
Let's have somebody else tell us that.
Yes.
I mean, I'll tell a personal story. I grew up in North Jersey in a farm, and my uncle's solution to everything is to take it out and throw it and move it down. I mean, I don't think I will be living at a house at the bottom of that hill.
I also agree. I mean, I think the role of our board is to protect the health of the citizens and mitigate health hazards as they come up. And, I think there's also just an issue of trust. And, there are many projects that have been well thought out but have failed because they didn't have community buy-in. And, I certainly from a public health standpoint, I think it makes the most sense to recommend to the planning board that testing be done, and I would certainly support doing that from the standpoint of an independent evaluator who's appropriately qualified and can come and do a site assessment, make their recommendations about whether they think there should be testing done or not, and if so, do it, and then the follow up in terms of appropriate mitigation as construction is going on and stabilization for the long term.
To be clear, we're not just overseeing plans.
No, we're recommending the planning board, the planning board asking for a recommendation. So we're recommending that an independent evaluation be done.
The only thing I worry about is every development. We don't have, we have a very small budget. We do very small reviews and setting precedent that every site that maybe cars worked on it. This does seem to be, there's a lot of mistakes there, but we have a lot of automotive uses. And we build houses, we tear down houses, and have like build houses for them.
I agree with you. And, if this was a site over in the Heights, on the other side of 128, and you're going to tear down the building, and maybe the site was contaminated, but you're just going to erect a new building covering the entire site with both building and parking lot, and nobody's going to live near there. Maybe okay. So what can little kids out there?
And I think also there is a long history to this property. It's not just coming up since April. There have been concerns that have been voiced and evaluated for almost 20 years.
I mean, actually, I'm surprised we haven't heard of this property before. Fire department did, I know. We did. That's my knowledge.
So do you need a motion? All right, so I'm going to move that our board recommend to the planning board that there be an independent evaluation of the property for the purpose of whether or not testing is necessary, whether or not the mitigations proposed by the builder are adequate, and we'll see what those results of that evaluation are.
I'll second that.
Okay, and all in favor?
Aye.
Aye. Okay. It is now 9:14.
We're never on that, so I mean, well.
So we have one. Are there any other issues that we would like to bring up with this meeting, or we have many topics upcoming?
I have an issue relative to rethinking our recommendations about mask wearing inside public buildings, specifically the senior center. I've received several complaints from people because no one's wearing masks at the senior center. And yes, based on our figures, probably everybody up there is vaccinated and probably boosted. But the point is that doesn't absolutely protect you from getting COVID. And I think that given the emergence of Omicron and concerns that everybody's got about that, I think that we should require that masks be worn inside the building.
And just specifically that building, or
Well,
all public buildings?
Might want to extend to all public buildings.
So, well, and we'll have to check on this, but I'm not sure the board necessarily has powers to do just one building because we're public, right? So we're looking for specific or broader than just one building and pointing out.
I'm just using that as my,
Yeah.
complaints I've got.
We can definitely write a notification or a letter to the town and say, we highly recommend that, the senior center be required to have masks, and that's something that the town management can do or determine.
Okay, I would go along with that. We strongly recommend.
Tiffany, this is why I want those numbers by population, because we need to know whether or not the vaccine really is waning in terms of its effectiveness in town. Because if
But
it
we
is,
don't, that's fine, but we don't get information on boosters, so we won't be the full information. We don't have a population breakdown of boosters and who's gotten them and who hasn't gotten enough total. The state doesn't provide that, so in its effect, yes, we can do a portion of it, but it won't be the full.
yeah, okay.
So yeah, if you guys would like to do something, then we can definitely send it to town management and ask that they put in a requirement.
I'll go along with that. Matter of fact, I'll make a motion that we back down there. Trying to consider requiring for mask wearing in town buildings. Yeah, just in town buildings, public buildings.
I mean, I think it is a very legitimate concern that we are seeing increasing numbers in the state. No doubt that our numbers in Needham will continue to rise. I don't know about you, Steve. I'm certainly seeing more cases of COVID in the hospital.
Well, I am, but I'm seeing it amongst some vaccinated. I've definitely seen some greater cases, particularly in the elderly. This hospital today, in fact, 66-year-old. I just want to make sure that we have some criteria on which we're basing it. That's all, because otherwise it just seems like it's kind of unfair. To some degree, yes, we want to be ahead of the trend, and it is that. But our percent positivity, are we going to be looking at, okay, just on the slope over the past 3 weeks has done this, and therefore we make a recommendation at this point in time. Because by the time the number is high, we lost, right? So it may just be that it's steep enough now that we say, hey, this is the time to be proactive and consider we should do this. That's all. I mean, I don't know if you've done the modeling, but we've got historical modeling from these surges now. I mean, we should be able to get on top of this and kind of see what's going on.
As again, I say with the emergence of Omicron, I think it's a pretty thing to do.
Yeah, I mean, I think we can make a recommendation. I mean, I agree we can make a recommendation to town management. I don't think I would mandate it at this point until we have something.
I think just, a recommendation.
We already have that in place.
I believe
They were gonna do sign in with it. We already have them, we already said that.
I think we should maybe just, if we already sent it, let's just send it again.
Or maybe specifically target that building with our recommendation.
We can certainly reaffirm that.
So I need to know what recommendation we're making.
Any message that we have is that it's strongly recommended. If you want to put up a sign, you see something. Right? That's what we were suggesting.
Okay. Motion to adjourn.
So moved.
All in favor?
Aye.
Thank you, everybody.